Alright, so a few hours have passed. We need to go back in and do more oral cares on our patient and we'll do an assessment. So knock. Hello, I'm Abby with Respiratory Therapy. I'm here to perform some oral care, do a basic assessment. So at that time, we can wash our hands and apply our PPE. The patient will be positioned. So first, we can start out by doing some suctioning. Our next in line is the swab section. So we can take our solution, hook it up to the suction, and we kind of just want to get in there and kind of clean it up, kind of get in the back to suction that all out as well. So we're suctioning that out while performing good oral cares, getting the tongues, the side of the mouth, getting that all nice and good. So then this is disposable, we can throw that away. And then we can go in with another swab and some moisturizers. We can apply the moisturizer, spread it around, and we can moisturize the lips, the tongues, the gums, whatever kind of seems dry. So once that is finished, if there is excess fluid, we can go in and suction again. Maybe the patient sounding, when we do our assessment, the patient sounds a little coarse, so we can do the inline suctioning, make them sound a little better. Kind of with that assessment, we want to make sure with the ET tube it didn't get pushed in or pulled out, so we can adjust that accordingly. Whatever, if it's supposed to be at 26, we just want to make sure it's at 26. We can reposition that tube to make sure we're not getting any skin breakdown. So then we're going to do some cuff pressure monitoring. So there's two ways you can use the device, or you can do it manually. So what we're going for here is we're just going to take our stethoscope, kind of press it there on the side of the neck. We will attach this to our pilot balloon. We can deflate the balloon, and then we'll start to hear a leak, or you'll hear the gurgly noises. And then once we have deflated that balloon, we can reinflate it to the correct pressure, and we'll know what's right when we cannot hear that leak anymore. With the device, you can plug that into the pilot balloon as well. You're able to adjust it, decrease it, increase it accordingly. We just have to remember that when we do use that device, that whenever you kind of get it in the area you want it, we need to take that off kind of quickly, just because once you take that off, you're losing a little bit of pressure. So you kind of want to go over just a little bit of what you're wanting so that you do get that correct pressure in there. We already did the patient assessment. They look and sound good. They seem comfortable, not restless. We can check their vitals, their O2, pulse, those things. If there's any changes when we did it, we can look at the ventilator and do that as well. And then we can let the patient know we'll be back in a few hours to do more oral cares. And that is it.